Welcome back, dear viewers, to a new episode of DocTalk. And today's episode is a little bit technical. We have Dr. Sundos Alhadhoud, a cardiologist and fetal cardiology, who will guide us and tell us more about fetal echocardiography. This device will help us to know the baby's heart condition inside the woman or the mother's womb. So stay tuned to know more about this device and the function of it. Welcome back, dear viewers, and welcome Dr. Sundos again to DocTalk.
Thank you so much for having me. And it's really an interesting topic because there are so many questions and debates regarding fetal echo. As you said, when do we need it? Why do we do it? What is the benefit of doing it? And I think this episode will focus on it, and the viewers will benefit from all the information that we're going to give them. So thank you so much for choosing that topic.
Well, it's our pleasure, and it is also important to address some pediatric conditions or children's diseases from the beginning of their life before coming even to reality or this life. So let's talk about this device, the uses, and what are the extreme and rare conditions that require intervention and the usage of this device.
Definitely. So first of all, the device is like the regular one that we use in adults or pediatrics. The only difference is the probe size. And what do you mean by the probe? It's this transducer that we use actually to see the images. And it's an ultrasound. So it gives sounds, and when it hits a surface, it comes back as an image.
Yes.
So this is actually the device and how we use it. Now, when do we use it? The timing, I mean the gestational age for the fetus itself. We have to know first, when does the heart form? And why, when a lady comes to me early, I will send her back and tell her to come at that period of time in order to give her a diagnosis. And this is because when does the heart form? And the heart starts looping. There are two tubes forming, and it's one of the two organs that forms first in the fetus or in the human body, the brain and the heart. So two tubes, and then they will get connected and they will start looping, and this happens at 9 weeks of gestation or 9 weeks gestational age. So why do you mean by looping, and why is it important? Because when they start looping and fusing, the two lower portion of the tubes will form the lower chambers of the heart, the ventricles, and the upper portion of the tube will form the outlet of the heart, which is the pulmonary artery and the aorta. So this is the forming that happens. Then the heart finish forming at the age of 16 weeks of gestational age, but it will start beat at 9 weeks of gestational age. So at 16 weeks of gestational age, the heart is fully formed. The ventricles, the atria, the four chambers of the heart, the outlets, the inlets, everything will finish forming. It will continue to form, but at that time, it's done. The formation. So you will have a clear information and clear image of the heart formation. So usually the age that we recommend is between 18 and 24 weeks of gestation. But there are certain limitations to that, and there are some certain criteria that we sometimes send the patient back even if she comes 18 and tell her to come later
stages.
And in these situations, like if the mother or the pregnant lady is obese, if she is earlier than 24 weeks of gestation, the uterus is lower than the umbilicus. So in order for us to get a clear view of the magnified fetal heart, it's going to be difficult and painful to the mother because you have to press really hard and to get that image, and it's not going to be clear. So if there is maternal obesity, especially around the abdomen, yes, we will send her and tell her to come after 24 weeks. 24 weeks, the uterus and the baby will be at the umbilicus. So it is easier to see the images. The second thing, if she had previous surgery, like if she had cesarean section, if she did abdominoplasty, any surgery in the abdomen, it will make it difficult. Why? Because once you suture the tissue, then or you put it back, the tissue that is going to make it stick together is not a normal tissue. It's an elastic one. So it's going to be really bright while you're doing the ultrasound because it's very thick. So it will have most of the ultrasound beams or waves. So it will not give you a clear picture. Also, the same thing, we'll tell her to come after 24 weeks for the uterus to be above the umbilicus and for a clearer view. Twin pregnancies, the same thing. It's going to be difficult to see, so it's better to bring her later in gestation. Now, these are the indication. If the person doing the fetal echo is not an expert, so this person will not get a clear picture, so also will not give a definite diagnosis. And if the baby have a problems, like if the baby amniotic fluid is less, so there will be enough space for the sound waves to travel, so it will not give you a clear picture. If the baby have any deformities, if the baby's position is giving you his or her back, also you will not get a clear position. Also twin pregnancies, if they are really close to each other, you will be difficult to have this imaging. Twin-to-twin transfusion, all of these are complications that might give you not a clear image. Now we come, when do we need it? And does everybody require fetal echo or no? We divide it into maternal causes and fetal causes. Maternal causes, it means that this is something that the mother or the pregnant lady have. So if the pregnant lady have any metabolic conditions, diabetic, autoimmune disease, hypertensive, if she's having thyroid, hypothyroidism or hyperthyroidism, where the thyroid is functioning more than normal or less than normal. So any medical condition the mother has, then we should have fetal echo to be done. There is any family history. If the mother have a congenital heart disease, then the percentage of her having a baby with congenital heart disease is 5%. If the father, it is 4%. Then if both of them, then it is 5%. And as we said before, 5% is not a small percentage. So it's better to rule it out. If the mother taking any medication, antipsychotic, anti-epileptic, antiplatelet medication, all of these requires her to have a fetal echo. If the mother is taking any alcohol or smoking or any drug abuse, then definitely we need to do fetal echo just to rule out the complication of those on the fetal heart. So these are the maternal causes I can think about now. We have the fetal causes, twin pregnancies, in vitro fertilization or IVF. Definitely they need. If there is an abnormality in the baby, any congenital anomaly in the baby, we need to rule out the heart being involved also. If there is thickened neck or what we call increased translucency, then this means that there is a big chance that the baby is having trisomy 21 or Down syndrome. So we need to do fetal echo just to rule out congenital heart disease. Twin-to-twin transfusion, where one of the twins give the blood to the other one. So one will be bigger, the other one will be smaller. So we need to do fetal heart to rule it out. And if the baby actually have abnormality like arrhythmias, so not only we rule out congenital heart disease, but also abnormal heart rhythm of the fetus, it is required to do fetal echocardiography.
Well, Dr. Sundos, I would like to talk more about these conditions and this device, especially when it comes to babies' health. But we need to take a break, and then we're going to keep talking about this device and the baby's health. So please stay tuned. Welcome back, dear viewers, after this short report, and we have with us Dr. Sundos again. We're going to talk about the most common cardio problems or heart problems that babies have inside the mother's womb, and how can we avoid them in the future after delivery?
Now we have congenital heart disease. Congenital heart disease, it means that when the baby's heart formed, it did not form very well, and there are some problems in the final picture or final formation of the heart. So if there is any holes in the heart, VSD, ASD, PDA, all of these will show. If there is an abnormality in the looping, as we said,
Yes.
So the right ventricle might be misplaced and the left ventricle might be, or the left side might be misplaced. So all of these we can diagnose them by doing fetal echo. There is any constriction in the valves or the outlets of the heart, we can diagnose it also. Changing in the places of the outlets of the valves,
Yes.
or the arteries, also we can diagnose them. If there is any constriction in them, not in the valves, while they are coursing outside the heart, then also we can diagnose it as coarctation. If there is, let's say, half of the heart is not formed, and
Okay.
as we call it, hypoplastic left heart syndrome or hypoplastic right heart syndrome, which means the whole one side of the heart is not formed. So this is a very serious condition, and it requires immediate action after birth. Tumors.
Okay.
There are tumors, and they are very common actually in fetal. And thank God, most of them, 99% of them, are benign. They resolved spontaneously after birth. But we need to diagnose them in order to diagnose the baby, because sometimes the fetus or these tumors are associated with syndromes. So it's better to diagnose them and see if they are obstructing the outlet of the heart or not.
Yeah.
Arrhythmias, we talked about it.
Yes.
So any abnormality in rhythm, whether it is fast or it is
Is it
slow
slow?
or irregular.
Okay.
So all of these will help to diagnose and maintain the pregnancy, and we try to make the pregnant lady and the baby reach the end of the pregnancy as much as
normally without any intervention. Okay.
Exactly.
Before the report, you talked about maternal and fetal causes. In maternal causes, is the age of the mother, plays a significant role in this?
Definitely, and this is a good point I forgot to mention. So any pregnant lady above the age of 35 will have to have a fetal echo done to her.
Okay, so above 35, it is required to do it, just to make sure that the mother and the baby are healthy and safe, and the mother will reach the final stages of pregnancy and have a normal delivery if the baby is okay.
Exactly.
Okay, so we talked about the age of the mother. How about, you talked also about the father.
Yes.
If he has like genetic disorders or genetic diseases, does genetic diseases play significant role here?
Definitely, and this is a very good question. The percentage of congenital heart disease in normal population is 1 to 2%. If there is another child, let's say the firstborn, have a congenital heart disease, whether it is simple or complex.
Yes.
The percentage of the second child of having congenital heart disease increases to 2 to 4%, double. If there are 2 children with congenital heart disease, then the chance of the third of having congenital heart disease is 11%.
So with every baby, this percentage is
exactly.
Higher.
And why is it important? And this is why the question actually I'm always asked in the clinic. Why do you need to do it? What are you looking for? I tell them we have 3 paths when we do fetal echo, whatever the reason, if there is a previous child or the mother or the father having. So either this baby will have the same medical condition. If it was a simple, then it might be also the same thing, VSD, ASD, the same thing. Or will have no cardiac disease. So this is the second path.
Yes.
The third and final path is having a more severe or complex heart disease.
Yes.
That's why we don't rely on history. I tell the mothers, even if it was a small defect and closed, you don't know what are the chances of your second child of having the same disease. It might be even a complex one. So we have to make sure that this is either a simple or a normal heart.
So you need to rule out all these
exactly, the possibilities.
Okay, one more thing. Does surgical intervention required after the echo?
This is also a good question, and I'm always asked, will you do anything for me if you diagnose? Then why are you telling me the bad news? I tell them for the time being, not many centers actually perform procedures on the fetus. Okay, we have seen some breakthrough in doing urinary catheters intervention or surgical intervention for diaphragmatic hernia and any other hernia and the fetus itself. But in the heart, still there are no breakthroughs. And there is only 2 centers in the world actually brave enough to do the surgical procedure on the baby. And most of them is to inflate a closed valve in order to prevent the, as we said, the half of the heart not forming, or hypoplastic left heart syndrome. The problem is there is a risk of miscarriage and losing the baby.
This is what I was
That's why not many doctors are brave enough to do it. But why then we do it? Why we tell the parents the bad news? It's not about the bad news, it's about timing of delivery. We can tell them you have to wait till the end of your pregnancy, or you need to deliver earlier.
Yes.
Mode of delivery. Can this mother have a normal vaginal delivery or cesarean?
Yes.
Third thing, does this baby, when it's born, require to be in intensive care unit?
Yes.
Or can be sent to the incubator, the regular baby's incubator?
Yes.
Does this baby require medication? Because especially in cases where the half of the heart is not formed, you require some medication to be given in order to make some ducts open, not to close after delivery, so the baby will survive and reach a certain weight, then we can do the surgery. So this is very important. So these questions can be answered and will be answered while we are doing the fetal echo.
Okay, and let's talk about the delivery. Now, the mother with the baby with heart condition reached the final stage of pregnancy, and now she's in the delivery room. Does medical intervention medical intervention immediately after the delivery, or, as you said, the mood requires some stages, some actions from the doctor who's involved, which doctor is involved, and the whole medical team?
It is really a tricky question, because people think that this diagnosis, all of them will have the same treatment. Why I love cardiology so much, because it's not a textbook. Each situation is different, even for the same diagnosis. So some cases, depending on the associated anomaly, and the heart, not one anomaly, sometimes many anomalies are associated. And these where we can decide, do we need to take this baby now to surgery, or we can wait 1 week, 1 month, 6 months, 1 year? This is one question can be answered. The second question to be answered, does the baby's condition can tolerate the surgery? Sometimes babies are born with defected circulation to the kidneys, to the liver, to the brain. So you need to stabilize the patient first in order to go through the stress of surgery. Third question to be answered, the baby's weight. So we have certain weight we can operate on. If baby having low birth weight, then definitely we cannot do anything, and we just need the baby to be on medication, gain some weight, and then bring the baby back in order for us we can do surgery. So it all depends on the baby itself. Don't forget the syndrome. If the baby having syndrome with a very poor prognosis, then we usually tell the parents we will not touch the baby, because the outcome, what's going to happen for this baby? Nothing. So it's better not to touch the baby. And
as you said, it's not a textbook. You need to know and see the condition first, and then move to the second stage.
Definitely.
So, Dr. Sundos, we're going to take a break and look at the next report, and then we're going to jump into myth or fact, my favorite. So please stay tuned after this short report. Welcome back, dear viewers, after this short report. Now, Dr. Sundos, we're going to go through myth or fact. So my first myth: fetal echocardiography is only necessary if there is already a problem in the baby.
No, as we mentioned, there are certain criteria in order for us to ask for fetal echo. As we said, there are maternal factors and fetal factors. So we don't wait for the baby to have a problem in order for us to do a fetal echo. And this is the question I actually always asked. My baby scan is normal. Why did they refer me to you? I tell her, because you have diabetes, and diabetes sometimes it affects the baby, so that's why it's better to check the baby's heart. You are a smoker, you take some medication, you have a previous child with congenital heart disease, that's why it's better to do it.
It's just like a prevention plan or a prevention step. Okay, myth number 2: the test can harm the baby due to strong ultrasound waves.
Oh, never. It's totally unharmful. It's the same as the one they do while this lady is pregnant.
Yes.
But we focus on the baby's heart. The second thing, the setup of the machine itself is set to get the dimensions, the clearer image of the baby's heart. That's why they refer the baby to us. I would like to thank the maternal-fetal medicine specialists in Kuwait. They are excellent in diagnosing, and they give the diagnosis to mothers. And that's why they come to me, they ask, okay, we already have the diagnosis. What's different thing you're going to do in order for us to get the diagnosis? And I tell them, yes, because my machine is more specialized and the setup is different in order for me to get a clearer diagnosis and plan for you and your baby.
Okay, so myth number 3, all heart problems can be fixed before birth, so there is no need to check before delivery?
No, as I said, intervention is still on hold, especially in Kuwait and many centers, only 2 centers in the world they do it. But let's say that this baby is having arrhythmias, slow heart rate. Most of them, they come to us. And yes, at that time, this is very dangerous on the baby, and the baby will not continue having the pregnancy. So we give medication to the mother in order to increase the heart rate, or the vice versa, reduce the heart rate in order for her to reach her term.
Yes. Okay. Myth number 4. If the round ultrasound looks normal, fetal echocardiography is unnecessary? The usual.
As I said, sometimes we have mistakes, even us as a specialized in this field. Sometimes we give wrong diagnosis. We either tell that the heart is normal, and then it turns out that there is something abnormal when the baby is delivered, and the vice versa, also the same thing. We tell that this is abnormal, and when the baby is born, then this is normal. And why is that? As I said, the previous points, maybe the mother is obesity, previous surgeries, twin pregnancies, baby's lie, baby's position, moving too much, or an experienced person, or sometimes it can happen.
Yes.
But it doesn't mean that having a normal scan is not necessary to have fetal echo, because sometimes the MFM might miss something and they refer to us for a second opinion.
Second opinion, just to make sure that there is no...
Exactly.
Okay. Only mothers with heart problems need fetal echocardiography?
No, we mentioned that. If the mother is having a congenital heart disease, the chances is 5%. If the father, the chances is 4%. If both parents, the chance is 5%. One sibling, 2%. 2 siblings, 11%.
Okay. Myth number 6. Fetal echocardiography guarantees a complete, healthy heart before birth?
No, nothing is guaranteed. As I told you, sometimes there are false images and false diagnoses, and mistakes can happen, even for the experienced one. And the number of mistakes in Kuwait is actually the same as outside abroad in more specialized centers. So it's all the same. Second thing, it doesn't mean because, as we said, the heart continues to function. So many cases I found that there is a question regarding the outlet of the heart. And I tell her, come back again, I want to see you in 5 weeks. When she comes, then the diagnosis is totally different. And when she asked, she said, you told me that there is a question, why now it's different? I tell her, because the heart continues to form, so you don't know what's going to happen in that period of time.
So that leads us to the final myth. Round scans may miss subtle heart defects that the specialized test cannot detect.
Definitely, and this is totally true. Even though the percentage of misdiagnosis or wrong diagnosis is low, but there are chances. And as I said, the percentage in Kuwait, it's exactly as the specialized centers abroad. So we try to lower that percentage, because each person matters, the mother and the baby. But we're at the end, we are human, and this is it is a sensitive test, but not specific, because it's operator dependent. So I can tell one diagnosis, my colleague can tell another diagnosis, but we usually have let's say a plan in reducing this problem. Whenever me or my colleague have a problem, we can just take a second opinion and discuss it among each other.
Okay, before we end this segment, I have a question. Is it complementary to the regular scans? That means in every appointment I need to do the 2 scans, or it's separate according to the opinion of the doctor?
No, it is according to the opinion of the doctor. Like if I'm very confident of my diagnosis, I will not check for a second opinion. But sometimes even the expert one will have a dilemma. So he will call me, I will call him, and 4 eyes is better than 2.
Exactly. So Dr. Sundos, that ends our segment, Myth or Fact. So please stay tuned for our final segment for today. Welcome back, dear viewers, to our final segment for today with Dr. Sundos. And before we leave, Doctor, do you have any advice for future mothers?
Most women, when they come, they ask a question. Do I need to be fasting? Do I need to urinate? Do I need to be taking something before coming? Is the procedure painful? Will it harm the baby? And through your program today and through this episode, I would like to reassure them that this is as the regular scan while you're pregnant. The same thing, I don't need you to be fasting, and does not require any certain foods to be taken, and it's not painful and not harmful to you or the baby. So just come to us. Most of the times the news are good. Even if the news are bad, the good thing is that we caught it early and we have a plan, so you and your baby will have a safe delivery.
Well, Dr. Sundos, thank you for joining us on DocTalk. It is a pleasure to have you.
The pleasure is
and
mine.
the information that you gave us are extremely helpful. So my dear viewers, also thank you for joining us, and until next time, please enjoy your day.